Dear students, we'll discuss a condition which is not uncommon, a sinus actually. So many things you have to think when it is so. So before discussing that clinical case, we'll quickly go through the MCQs. So commonest spine involved by tuberculosis is A, B, C, D. Find out the right answer. Put it in the comment box. I acknowledge, I appreciate your answer and put the right answer later. Preauricular sinus is A, B, C, D. Again, put the right answer. Acknowledge your answer and put the right answer later. And before going to the clinical cases, I request students please subscribe my YouTube channel. It is free. Also, it gives a channel to you to learn surgery on day-to-day, daily basis about images, X-rays, instruments, specimens, clinical cases, operative surgery, all other things for 5 to 10 minutes lectures on day-to-day basis easily. And also we'll have a live session for 1.5 hours once in 2 weeks where students will present a case and faculty other than me, other faculties also, senior faculty will be there. We'll have interactive session, so how to present a case, how to discuss a case, how to face the exam in particular cases. So it will be very, very useful for you to learn to present a case and face the exam, practical exam as such. So, and if you join live session, you get a certificate also. So again, request student to join, subscribe my YouTube channel, share with your friends and colleagues and press the bell and go through the discussion. So what this condition is, look at that. You can see the spine is here. Look at the discharge here. It's the discharging sinus. All of you know that this sinus is a blind track connecting exterior. Inside it communicating somewhere. Probably lining is epithelialized. Maybe due to foreign body, maybe due to tuberculosis, maybe due to actinomycosis, maybe due to malignancy, maybe due to previous surgery, maybe due to epithelialization, maybe there will be collection, infection. So many causes are there. This is the sinus. So sinus differs from ulcer in that ulcer has got a flow, visible flow. Sinus does not have a flow. And sinus is deep always. Ulcer may be deep, may be superficial. Different types are there. I'm not going to discuss that. And so that is the difference which you have to remember. There's so many causes for sinus, malignancy and other things I already told. Spine is this is very close to this one. Spine is the common cause to have sinus here. And maybe pyogenic disease of the spine, or commonly, at least in developing country like us, it is tuberculosis, the spine causes this one in this patient. So you have to examine the spine for movement, for deformity, paraspinal spasm, spinal tenderness, and movements. So examine detail is important. Fistula is different from the sinus. Fistula is connection between exterior to the hollow viscus or between two hollow viscus as such. So here it is only blind track. It is a blind track. Fistula is a connection. So that difference you should remember always. And so think of all these things, whatever I have told, causes, and accordingly evaluate, do a discharge study, take a biopsy, do a image study, MRI physical, MRI of the spine, find out the focus and treat accordingly. And this patient, for your understanding, this report came as a tuberculosis. It's a tuberculosis sinus arising from the spine. This was treated conservatively with the rest and anti-tuberculosis drugs for 9 months, and spine became all right. Sometimes you have to do a spinal decompression, spinal fixation may have to do it. You have to take spine surgeon's reference and help. In this patient, of course, luckily without all those surgical intervention, patient got cured by proper, continuous, regular anti-tuberculosis. Very, very important. So for details about the sinus, ulcer, fistula, please go through my clinical methods in surgery and my manual of surgery. Quotation of the day, students, you will become more tolerant, less judgmental once you realize that nothing is permanent. It is, especially surgeons, it is useful when you lose a lot of patients. So many patients in the ICU, you see death daily, and then you become so much why it is so. So this is the important quotation. And students, please have my clinical method in surgery, which gives detailed method of examination with lot of clinical photos with the differential diagnosis in the tabular form. Cover general surgery to hernia, hydrocele, thyroid, breast, varicose vein, ulcer, swelling, peripheral gut disease, abdomen examination, urology, specialty, briefly orthopedic with the instrument and specimen. And each chapter has got a QR code. If you click that, you'll get a examination video
live how exactly you will examine each hernia, for hernia, like that hernia, thyroid, breast, general examination, and so on. Very, very useful, extensively discussed, best clinical method book actually for surgery. But there is no management in clinical methods, only examination and differential diagnosis. Remember, very useful. Please go through my book and my Service Manual of Surgery. It's a very useful book, best book, with according to CBM syllabus, and from general surgery to varicose vein, peripheral disease, breast, thyroid, GI, urology, specialties, not orthopedic, and anesthesia, adjuvant therapy, instruments, operative surgery, with a lot of footnotes, entire detailed management, investigation, the treatment concept, tables, lot of illustrations, photos. Each chapter has got an online link where you can go through the MCQs, which is very, very useful for you to learn face exam, learn face competitive exam, face NEET and other things. So this book covers everything as far as it is considered to face exam, all type of exam, including competitive exam. So always have my manual of surgery. It will be very useful. Also my digital lectures through JP Publisher, 220-hour lectures covers everything, including examination, operative surgery, instrument, specimen, examination of all types and all topics in detail with the management, with the PPT lectures by me. It will be very, very useful. Purchase for 1 year. That will be very useful to learn surgery very easily wherever you want. So learn subject, nutshell, all with all my books and my digital lectures. It will be very, very useful to you. So also students, again I request you subscribe my YouTube channel, share with your friends and colleagues, learn surgery daily on day-to-day basis. Students, I hope you understood this lecture very well. Thank you so much.